There is a quote that says, "When white people catch a cold, black people get pneumonia." This quote is typically used in political and economic spaces to mean that economic or healthcare issues that affect white people would disproportionately at the same time be detrimental to the black and brown community. My version of this quote would be, patients that get mistreated in the hospital are not part of the majority, but when a patient gets mistreated, they are usually minorities. This isn't based on speculation or conjecture. One problem that our healthcare system faces is the inequality of care and discrepancies between different patient groups based on race, ethnicity, and gender. Sickle cell is one such patient group that has been historically marginalized and stereotyped in the healthcare system. We suffer through a lot of pain, and people in healthcare do not understand the issues that we face within healthcare that prevent us from having the same quality of care and, by extension, quality of life as other patient groups and even other people in general. What's good, you guys? Coben back. It's a different day and a different month because I stopped recording this video when it was like mid-May or early May, because I went to a sickle cell conference that's, in Texas, and after I came back, I had a pain crisis, so I went to the hospital again. That kind of set me off course a little bit with this video. However, I was already gonna talk about me being in the hospital for a period of this video, but now that I have new evidence or new experiences, I will share some of that as well. So with that being said, let's just get into this video. This video is inspired by my recent hospitalizations in March and in May. And in those visits, I was met with what most sickle cell warriors face in these hospitals. Your pain does not get believed. You don't have proper pain management. You don't get to change a doctor's mind on what they need to do to fix your pain. And it may or may not result in you not having your pain crisis resolved. And I'm not a very confrontational kind of person, so I prefer these hospital visits to be just very smooth and not contentious at all. However, these last two visits, I have had to step out my shell and pop off at a nurse and at a doctor for stuff that they just either don't know how to do or refuse to do, despite their knowledge and the fact of me being in pain. So I don't want you guys who are watching to be ashamed or not, feel away whenever you have to speak up for yourself and have to advocate for your proper treatment in these hospitals, because of course you cannot fix how biased a doctor can be. And if the bias is determining your pain management plan, then that is an issue if you have certain needs that aren't being met. So I recommend that whoever you are, wherever hospital you go to, it doesn't matter if it's a good hospital for sickle cell, if it's a bad hospital for sickle cell. You can determine how the trip goes despite the label that you have on that hospital if you speak up for yourself and what you need the right way. You don't have to be rude. You don't have to be disrespectful. You can be, proper and just not have to get in their face and be loud. You can advocate respectfully, like I had to do. I did not like it at all because I'm not very confrontational. However, it had to be done because, of course, my life is in their hands. All of this is happening while we are in pain, by the way. So our pain has to be masked in order to properly address these problems in healthcare, which is both extraordinary and sad. This scenario ties into what a lot of people call medical bias, or a bias that is a system error or disparity in clinical decision-making, research, and treatment. It stems from unconscious human biases such as racial, gender, and cognitive bias, as well as systemic flaws, which frequently result in unequal health outcomes, misdiagnosis, and unequal access to life-saving care. In April, there was a conference held by the Renal Physicians Association, and in that meeting, Dr. Joel Burvell outlined multiple examples of how race-based medical practices have persisted for decades, influencing current medicine. He goes in to mention the effect of race-based medicine in academia. Pointing to a 2016 study regarding pain assessment and false beliefs about biological differences between races, he said 50% of the medical students and medical residents endorsed at least one false belief. Those that were likely to endorse one false belief also were more likely not to prescribe pain meds adequately. He then goes on to say sickle cell is perceived as a black disease due to the disease being more prevalent within black populations. However, anyone can have sickle cell, and the only reason some black individuals may harbor them more often is due to their ancestry, giving them a sickle cell allele to protect against malaria. Instead, many medical students are primed to think about specific disease states as affecting only one specific race, reinforcing race-based medicine. The key word in that last paragraph is perceived. Sickle cell is perceived as a black disease, and perception does not always mean reality. Though the healthcare system is scientific in nature, doctors have internal bias at all times. Regardless of the scientific literature, doctors can make decisions that aren't always based in reality, that aren't always based in logic, that aren't always rational, that sometimes is detrimental to the person being treated. This is something that Dr. Joel Burvell was seeking to address regarding race-based medicine. We have to remember, a doctor always has bias regardless of the patient. Therefore, a patient being biased against isn't new, and therefore is not the real reason why our pain is not believed. Sickle cell is something that does not affect all people, and not all doctors have experience treating people with sickle cell. Just the fact of them not being experienced is itself part of that bias, and part of the inefficiency of their decision making, depending if they don't consult a hematologist. So therefore, we cannot blame just their bias on why we get mistreated in these hospitals. Outside of race-based medicine and bias, sickle cell patients face something entirely unique to us regarding barriers to quality of care. The stigmatization of opioids has been a negative influence on how we get treated in these hospitals as sickle cell patients, and we can go into the ways of how propaganda and political movements of the 20th century have shifted the perception of what drug use means for black people versus white people, but that may be another video. With each video, I always provide receipts, so coming out of Eureka Alert in April of this year, called Opioid Use Stigma May Underlie Clinician Biases Towards Patients with Sickle Cell Disease. It speaks on how in season 1 of The Pit, a black woman with sickle cell arrives at the emergency department in acute pain, only to be initially dismissed as drug seeking. In my video called Does Hollywood Do Sickle Cell Justice?, I speak about this episode. If you want to see my breakdown on this episode, click the link in the description, and it'll be in the title card as well somewhere. In the article, it says that new research led by Dr. Wesevich and colleagues at Chicago Medicine unpacks the intersectional biases that may underlie the disparity in healthcare quality. It goes on to read that the study builds directly on what has been published in 2022, which found that black patients had more than 2.5 times the odds of having negative descriptors in clinician notes compared to white patients. Another study from 2024 explored the downstream effects clinician biases have on the quality of care patients receive, finding that when clinicians hear a patient described with negatively biased language, they give less empathy for the patient and in some cases less accurate recall of the patient's critical health details.
But wait, there's more!
By extension, if we go down further, it also states that research found that patients with sickle cell disease had higher odds of having negative descriptors in their electronic health record compared with black patients and patients with chronic pain, but had similar odds of negative descriptors as patients with opioid use disorder. This suggests that bias towards patients with sickle cell may be most strongly tied to opioid use stigma. Non-black patients without sickle cell disease, chronic pain, or opioid use disorder had fewer negative descriptors than the other patient groups. First of all, let's talk about you in the hospital, right? The doctor comes in the room, it's like, hey, what's your pain from a score of 1 to 10? You say a 10. but you know, are on your phone, you're smiling, you're doing stuff that does not signal that you're in pain to a doctor or a physician. So they put in your notes, hey, this person is drug seeking, or this person is, you know, just not telling the truth. They're not prescribing to the idea of pain that I've had for my whole life, being you're crying, you're physically uncomfortable, you're doing these signals that indicate how much pain you are in. This person that has sickle cell does not show these things, and therefore I won't be able to medicate them with the proper pain meds because I have a bias in what I want to give patients that clearly are lying and clearly showing evidence that they just want to get high. Basically, it would go something like this.
All right, what's your name?
Victoria,
All right, on a scale of 1 to 10, what would you rate yourself?
broke my scale.
You broke your scale?
Broke the scale.
No, like on a scale of like 1 to 10, like if you had to rate yourself on a scale of 1 to 10,
Yeah, I'm
like
saying.
10 is the highest you can go. And like
Past 10.
past 10,
Yeah.
all right, like let's get serious. Like
What
on
you
a scale
mean
of
get
1 to 10,
serious?
because you're not being serious. Obviously,
I am
like stop the
being
cap.
serious.
Let's stop the
So
cap.
what's your rating?
Let's stop. What would I rate you?
Yeah.
I mean, you look kind of good today. I ain't gonna lie.
I'll give you,
I'll give you like a 4 out of 10.
Stop playing with me. You capping.
Why you think
Why
I'm
you
lying?
lying to yourself like that? It's not good to
You
lie.
gonna take my lines? That's what
Lying is a sin.
For sure, I appreciate you. Don't shake my hand, my girl.
There's an article from Surrey Journals called Communicating and Understanding Pain, Limitations of Pain Scales for Patients with Sickle Cell Disorder and Other Painful Conditions. In it, it says, distrust and skepticism are also key factors in understanding communication of pain. Negative stereotyping of racial and ethnic minorities may undermine trust and increase skepticism. Sickle cell patients describe their pain reports being doubted, disbelieved, and treated as evidence of low pain thresholds or drug-seeking behavior. Observations supported by providers, some providers, both specialists and non-specialists, directly say that they are skeptical about patients' pain reports. When providers make their final judgment about the pain of the patient, they have multiple sources of information. For instance, the self-report of the patient, patient behavior, the provider's judgment, medical records, case histories, and medical tests. Going down further, it says sources need not be treated equally. Ethnographic data suggests that providers can view objective data as less tainted or less unreliable. Sources may also agree. 50% of sickle cell patients lack physiological signs during a pain crisis, and if there is no evidence from an expected source, say expected behavior is absent, this can be taken to suggest that pain is absent. Empirical data is lacking on how providers aggregate evidence in practice, of course. Because if we audit how doctors come to conclusions on how they treat patients, then we would find a lot of racists, a lot of sexists, a lot of prejudice behavior, a lot of bias behavior as well. So doesn't surprise me at all that we don't audit the way doctors doctor. We talk a lot about how the hospital game is rigged, or the medical system is rigged against people of color, but we do not talk enough about how it isn't rigged, because the system is not broken. It works exactly as it was intended to work when it was built. The problem is that it was not built when it was built to serve people of color, and by extension serve people with sickle cell, because of the stigma that people that have pain and have sickle cell face. It's aligned the Venn diagram for sickle cell, different things we experience as sickle cell warriors and things that we experience as people of color in these hospitals are aligned. So the reason for us not getting treated well in these hospitals is multifaceted, and mainly is because of how the system of medicine and the hospital system itself is built to stigmatize those that do not fit their patient or client criteria. When a sickle cell patient is undertreated for pain, which is happening every day in hospitals across the world, that is not an accident. That is a system doing exactly what it was built to do. I hope this video is a sobering reminder to everyone in the sickle cell diaspora that though we do have these new gene therapies, and though we have recently added the new bill in Georgia and other parts of the state and country, these issues with stigmatization and racial bias and cognitive bias and doctors mistreating us will not be solved with these things alone. You can have all the gene therapies and all the policies that you want. You can host all the sickle cell events, the marathons for sickle cell, and the conferences for sickle cell that you want. But if nothing changes with how we are treated in these hospitals, there will be no true progress. When white people catch a cold, black people get pneumonia. When a patient gets mistreated in a hospital, that patient is usually a minority. And with that, that concludes this video. I thank you guys if you watched for this long. I appreciate you. Thank you for watching, and don't forget to like the video and subscribe to the channel for more sickle cell content. I deliver you guys consistent videos on sickle cell because I have sickle cell and that it's sharing my experience living with sickle cell. I also have a game coming out for sickle cell, so keep on the lookout for updates on that. And with that, I will see you guys in the next one. Bye for now.